I used to like go football, concerts. I was always out doing something. You know, I was never one for like, you know, just sitting around. I had a fantastic life. At the time, a fantastic girlfriend who became my wife. I had a job I loved, a house I loved, but the alcohol took it all away. And then it got to a point where I thought, whoa, this is out of control. Because I'd lost everything, and I mean everything. I'd go out at the weekends plus Monday. Then it was Tuesday, then Wednesday, and before I knew it, I was out every day of the week. You know what I mean? It got to the point where I couldn't physically walk. I was shuffling around on my backside. I couldn't go upstairs. I used to have to sleep on the settee and go to the toilet in a bucket. I chose to do it, and I had the choice whether I wanted to live or die. There's millions out there who haven't got that choice. I had a really bad bleed in my stomach that caused me to be rushed into the intensive care unit, where I actually died 3 times. And they said after the 3rd time, if it happens again, there's nothing more we can do for him. You know, ambulances, and you know, that was my life.
I've worked with Mark for a number of years, and since the inception of this team, we've worked together with high volume service users with alcohol problems. And if I identify a patient that I feel has got an alcohol-related long-term condition that is calling us frequently, that is not finding it easy to engage with the normal health pathways, so like the GP, and that they are tending to get their primary care through the ambulance service and through attending down to ED, then this is somebody that I would then refer on to the long-term conditions team, you know, to say, do you think this is somebody that you can work with?
Greg's a really good example of it. He's in contact with lots of different services potentially, but actually what we've been able to do is do it all under one service, not having to keep passing it on.
I can't really put into words how my life's changed in every single aspect. I mean, now I'm buzzing on life. I love it. And every day there's always something different to do. Whereas before it was like, I'll do it tomorrow, I'll do it. And tomorrow never comes. And I know it sounds dramatic in that. If I not receive the help I have, and I continually have it, I wouldn't be here now. I know that. And so do the doctors and the surgeons. So, you know, it can be done.
This has been a really huge step forward in terms of quality of care, I think, for a group of patients that had really very poor care, a very disjointed care before. I think we'd all be very concerned to go back to the way it was when we see what can be achieved with an extra level of input, really.
Once we're involved and they trust us and they start to work with us, they don't reach those crisis points as often because we kind of put the brakes on before they get to the crisis point.
When Emma comes round to visit me once a week, I think sad. You know what I mean? Because we do discuss all the alcohol and that. Plus we talk about other things. You know, to lighten it. You know, because you don't have to sit here, you know, talking for an hour about drinking because it's boring.
You know, you normally have to go to an appointment. You have to appear motivated, and we're actually flipping that on the head. We're actually saying, we know you're in trouble. We're going to go out to you.
Traditionally, those people have tended to be ignored by services rather than supported, and that's led to most of them continually having to turn up at the emergency department or some other form of emergency care to get access to the treatment they need. So I think we would see this as the model that definitively works. We know it improves care dramatically, and we probably need more of it over the next few years.
You've got service here, and it's living proof. You're looking and hearing it. I am here because of your help. I'm part of the human race again.